How do you know someone has high blood sugar? Well, I'm going to use myself as an example. I have diabetes. I'm diabetic type 2, and when I have higher blood sugar, which they're very controlled right now, but when I was first diagnosed, I had the 3 Ps, so polyuria, polydipsia, and polyphagia. So they're often called the 3 Ps, where you're increased thirst, increased hunger, and increase in urination. So other signs and symptoms are blurred vision. But once blood sugar goes extremely high, greater than 500, that's when you can start having complications such as deep rapid respirations, a fruity breath. Your urination is really increased because think about that diuresis, hyperglycemia. So what would that be? That's most likely diabetic ketoacidosis, which has never happened to me before because mine has been pretty much diet controlled. Whereas quite the opposite, hypoglycemia makes you feel anxious, like you're panicking. You feel like you're going to faint, like you're going down. You start sweating. And if it's really low, you can start becoming confused. So if you don't get that sugar protein source in, you're going to start getting into confusion, and that would be very life-threatening. So the difference between hyper and hypo is hypoglycemia needs to be treated immediately. Whereas hyperglycemia, that's more of long-term complications. So yes, it needs to be treated. We don't want these patients to go into diabetic ketoacidosis. But we'll see patients walk around with high blood sugar, and it's more of a long-term life-threatening complications they can have, such as damage to the large and small blood vessels in the body and the nerves. Pain receptors, all sorts of things. Whereas hypoglycemia is you can have immediate death if that is not taken care of. Now I'm going to go to metabolic syndrome. Metabolic syndrome is very important to me because I feel like there's so many people that are underdiagnosed because this is really the precursor to diabetes type 2. Metabolic syndrome is basically an insulin resistance problem. And I'm just going to use myself again as an example because you can see how the timeline went. So I have had high triglycerides since my 20s, and I've been in a normal BMI for ever. Okay, so let's talk about metabolic syndrome. I feel this is very important. It's very underdiagnosed, and I'm going to use myself as an example because I have the perfect timeline of insulin resistance that crept up into diabetes. So years ago in my 20s, I was diagnosed with high triglycerides right here. Oops, on erase. I was diagnosed with high triglycerides, and the doctors were like, well, let's just watch it. And of course, I want to be in denial and be like, okay, I'm eating too many carbs or what's going on because my BMI has always been within the normal range. So then when I was pregnant with my 3rd child, I ended up with gestational diabetes, which is a risk factor, thinking, why is my body unable to process the carbohydrates? So then after I had my 3rd child, I ended up now still having high triglycerides, but my fasting blood sugar started going over 100. And again, they're like, well, let's just watch that. But in the meantime, this whole entire time, my HDL has been low. So I've had a low HDL and high triglycerides for years. But then my fasting blood sugar started creeping up. Always had the normal waist circumference and do not have high blood pressure. So you need 3 out of 5 criteria to be diagnosed with metabolic syndrome. And it needs to be treated seriously because these things will eventually spill over into diabetes. Once that blood sugar starts going over 125, then you're diagnosed with diabetes because you have that insulin resistance. That is what this is in a nutshell. So you can see why if you look here, you can have elevated triglycerides, HDL, and high blood pressure, but have a normal fasting blood sugar and therefore you're going to be missed, because these people should be going on metformin. But I just wanted to please make sure that you know this criteria. And waist circumference is greater than 35 inches in female and 40 inches in male. And I always say to the men, it's not your waistline, it's the belly, around by the belly button. So make sure that you know these and you understand the criteria. So in summary, make sure you understand how gluconeogenesis, glycogenolysis, oh my gosh, I can't talk. So in summary, make sure you understand gluconeogenesis, glycogenolysis, and how it breaks down into glucagon. Understand type 1 versus type 2, pathophysiology, meaning a complete lack of insulin, versus your pancreas still does not have complete destruction of beta cells, although it can, but it's more of an insulin resistance issue. What are the effects of hyper and hypoglycemia? What are the complications of hyperglycemia? Remember the diuresis, the cells become dehydrated. What are some symptoms of hyperglycemia and versus hypoglycemia? What is HHS? Understand the pathophysiology, diabetic ketoacidosis, and metabolic syndrome that we talked about.